A storm gathers as we turn off the Apache Road in Teoriang village in Kwania district. In the vehicle is 27-year-old Kela Obura traveling back to the home where she has just buried her child. Her son, 4-year-old Kicharwot Timothy, died of malaria.
When you rush the child to health centers, there is sometimes delay. She says the health worker do not respond quickly, much as you're saying the baby is not well. Sometimes they delay to support them. And the aspect of medications.
Obura says the illness started at home along Lake Kwania. She first sought help at Nambieso Health Center 3. Her child was diagnosed with malaria, but his condition worsened. They were referred to higher facilities, but treatment came too late. On March 24, 2026, Kichwarwot was pronounced dead at Lira Regional Referral Hospital.
This child came in a very critical condition. The child presented with fever that was high grade, with associated multiple complications, was vomiting, unable to feed.
At Lira Regional Referral Hospital, the pressure is constant. Hundreds of mothers arrive daily with sick children.
The spike came around March now, April, when the rains are up there, and we registered an increase of more than 15% in the cases that came to the regional referral. But of course, among the people who are dying is mainly in the children under 5.
Some days, health workers say they see up to 1,500 patients. Doctors say no patient dies at the outpatient unit, but many arrive too late for treatment to save them. Most children here are suffering from severe malaria. Between October and December last year, the hospital recorded 2,437 malaria cases at the outpatient department. Doctors explain that in severe malaria, parasites damage blood cells and block blood flow to vital organs. The brain, kidneys, and lungs are most affected. This can lead to complications such as kidney failure and cerebral malaria.
If it means even carrying the baby, you will carry the baby and the mother follows you, so that the baby reaches the ward immediately and started on treatment immediately. The treatment may involve oxygen administration. It may involve IV, artesunate, no longer oral. Of course, this one cannot swallow at that point. That means all treatment now will have to be through the veins. So it should be started immediately.
5-year-old children like Marceline Ayongi have survived only after advanced treatment. She required dialysis after developing kidney complications.
We keep our children out of mosquito for proper medication and proper care, for them to be our future mothers and future generation that we are building them for. That is my only advice, and I'm not scared of anything. I told my girl has fully recovered and she's okay.
Studies in Uganda show that severe malaria can also affect a child's long-term health and learning ability. At the Lira Hospital, doctors are tracking children to understand long-term complications, including kidney disease.
Some die before reaching the hospital, but then others develop other complications that can affect the quality of life after this illness.
Government programs aim to reduce malaria deaths through mosquito nets, rapid testing, and treatment within 24 hours. But health officials say gaps remain. Malaria prevalence after years of decline is rising again in some regions.
In case anyone is notified that there is a severe malaria patient in a outreach or anywhere, in any part of that catchment area, they are able to pick that patient as a priority, treatment before you rather seek care.
Scientists are now exploring new approaches, including gene-drive technology, which aims to reduce mosquito populations that transmit malaria. Anopheles gambiae is one of the main mosquito species responsible for transmitting malaria in Uganda. and it commonly carries Plasmodium falciparum, the parasite that causes severe malaria in humans. Researchers say it is still in experimental stages and has not been released in Uganda.
Most people fear that if we bring in novel tools, like genetic control tools, they are going to wipe out all mosquitoes. No, it's only those few species that have the capability to bite you and transmit malaria to you.
We are probably maybe 6-7 years away, if everything goes well, before we can say we have a tool that will have been, field demonstrated to be efficacious. So it's still some time. We still have some ways to go, but that's also being very optimistic because it takes lots of time, lots of regulation, because this kind of technology and everything genetically modified requires, regulatory oversight, and for good reasons.
But today, the burden is not visible in districts like Kapaj. Health officials describe it as one of the most affected areas in Uganda. Children under 5 remain the most vulnerable.
Because when everyone sleeps under a treated mosquito net and consistently utilize it, we'll realize most likely zero malaria infections in the community.
The country reduced malaria prevalence among children under 5 from 42% to 9%. The progress is driven also by residual spraying, but new data from the 2024-2025 Malaria Indicator Survey by Uganda Bureau of Statistics shows a worrying reversal. Prevalence has risen to 21%. In some regions, the situation is even more severe, reaching 59% in Lango, 46% in Acholi, and 44% in Teso. In Teuriang village, Kela Obura still visits the small grave of her son. For her, malaria is no longer a statistic. It's a personal loss that never fades. Razia Othman, reporting from Kwania district for New Vision TV. This reporting was produced with support from Target Malaria.
New Vision TV. Stream smart, stream New Vision.